Welcome back, everyone. Thanks for joining us on MorningLine today. It's our final segment as we talk about health care in the state of Tennessee in the wake of the Supreme Court decision on Obamacare. Michele Johnson's with us from the Tennessee Justice Center. Nice to have you on. It doesn't surprise me that we're not getting a ton of calls simply because it's confusing. There's people out there that may already have their health coverage. Others that don't are sitting here listening, trying to figure out what they can do. And maybe that's where I want to go in this final segment, is to kind of lay out for the average individual. If you're sitting out there and you don't have this insurance right now, and you're wondering, first, what kind of help and where to go, and two, what steps should you take not only to educate yourself but maybe to get your lawmakers more involved, which pretty much seems clear there. Just contact their office, right?
Absolutely.
Call, send letters. Now, can they get through? What do they do if they contact the Justice Center? Well,
I mean, basically, we have a page that gives you, whether you have 5 minutes or whether you have 5 hours to devote to this, we have a page that gives you menu items that you can do to get involved, educate your neighbor, and to become part of the Counting the Cost tour. I mean, we believe that this is a great opportunity for the first time in Tennessee history to work across party line, you know, to make our state better. And that's what's so inspiring. Like, what has been so inspiring about this work has been meeting people, you know, of every income level, of every race, of every political party, all saying, like, we care about our neighbors and we can do better. So if you're interested in that, we have a page, an action page. You go to tnjustice.org/action for InsureTN, and that will get you the menu items, making sure that people who are living in the coverage gap know we want their story is super important. And this page,
what do you mean? You want them to call and tell you their situation?
We want them to call so that we have that their story is part of the Counting the Cost. So if there's somebody, a waitress waiting on you, just ask her, do you have health coverage? You know, the fact is, most part-time employees, most service industry folks don't have health coverage, and they should. You know, they're working hard. They should have the peace of mind that health coverage provides.
Okay. Now, you know, there are some people that are going to watch this that say, wait a second, we don't like Obamacare, and Michele, you're all for it, and, you know, we want to have the other side. And I've tried to, we go in that direction as well, and the lawmakers, we know where they stand. Let's see what Sam thinks. Sam, good morning.
Good morning.
Hey, Sam, go ahead. So you don't like Obamacare, and you think that it's probably not a good thing for Tennessee?
Yeah, that's true. I think that most Tennesseans understand that federal dollars mean federal control. You can't get federal dollars without them sooner or later wanting to control you. And that's the main reason that Tennesseans and other folks across the country have opposed Obamacare. It also means, I've been in the medical community when I was younger, and it means that research will be truly reduced drastically, because there will only be a few pet projects that the federal government wants to get involved in, and whatever the federal government says can be done will be the only things that will be done. It will be nearly impossible for anybody else in the insurance industry or in the medical industry to do research and have it funded, because the money will be squeezed so tight that they won't be able to do it.
Okay, I mean, those reasoned arguments, I've heard some of those, and I appreciate you calling. I mean, what do you think? I mean, I have heard before, and it's good that Sam brought this up, about the idea of giving up control, and your take on that. I mean, if they're funding and providing the money, then maybe the states lose some control. Maybe that's worth giving up if you're getting people covered. What kind of control would be given up?
Well, I mean, I guess the question is, what legislators have said, what Ramsey has said is, we want a block grant. Just give us the money and let us do what we want to do. Right? So, I mean, I don't know about you, but if somebody asked me for $1.7 billion and said, and I don't want you to ask me any questions about how I spend it, I would be a little bit hesitant. I mean, folks have been talking about block grants for 20 years. You know, we've had Republican presidents. They've been talking about block grants. Nobody's going to give $1.7 billion and say, we don't care how you spend it. I mean, the fact is, Governor Haslam went to Washington. He talked to them about limiting their control. So what our office has pushed for a straight-up Medicaid expansion for 18 months. This is not a straight-up Medicaid expansion. This is something that enables the state to control lots of aspects of this deal in ways that other states don't have. So, you know,
Yeah, Haslam negotiated that to his credit, so it gave us more control.
Yeah, and I guess the fact is, the Tennessee overwhelming majority of Tennesseans are supportive of this. There's been polls by a variety of sources that have said the overwhelming Tennesseans are for this.
Yeah, money's like that heavy earmarks, and I wasn't sure with regard to the research issue and whether or not money's going like this is going to, put a stop to some of the medical research that goes on.
I mean, the fact is, this money's already set aside. It's already appropriated for this purpose, and it is being spent by other states. So, whether or not, it should have been appropriated, it's out of our control. The question is, it's sitting there now. What are we going to do? Because we can't spend it on research as it sits there. They're not going to take the money out of Tennessee and spend it on research. They're spending it on other people from other states, like Ohio, like Arizona, like Arkansas.
That are taking the money. All right, let's go to Reverend Fuzz. Good morning, Reverend.
Hey, good morning, Nick.
Hey, good to hear from you.
Good. Listen now, I don't know if you heard the story of the man in Kentucky who signed up for the Affordable Care Act, and after he finished signing it up, he said, wow, this Affordable Care Act, now I like this. This is so much better than that Obamacare stuff.
I had not heard that, but it doesn't surprise me. What do you think of that?
Well, I'm just suspicious that in Tennessee, a lot of the holdback is the fact that people are thinking, they just against Obama. But my first phone call this morning was with Dr. Dwight Montgomery, Reverend Dr. Dwight Montgomery, who's the president of the Memphis chapter, SCLC, Southern Christian Leadership Conference. And he's going to come to my church tomorrow. We're holding a rally to kick off a petition drive for Insure Tennessee. Memphis and here in Middle Tennessee, we want to have 100,000 signatures to take to the legislature this January session. And I think all your listeners ought to, know that they can come out to that and hear Dr. Montgomery and what they've done in Memphis to get tens of thousands of people signed on this petition to, and then I say to Dwight, I said, well, Dwight, Dr. Montgomery, look like all the citizens in the state, mostly everybody's in favor of Insure Tennessee, so why would they even need a petition since they know like over 70% of Tennesseans favor this? Will they respond to a petition? But we are going to kick that off tomorrow at 12 noon at Corinthian Baptist Church, a community awareness rally about Insure Tennessee and some other issues. And I wanted to get that out there to let people know that Nashville's involved in pushing forward to this.
Reverend, thank you for calling and sharing that this morning. And and maybe we can get out there with the media as well.
Okay, take care.
Thank you, sir. I appreciate that. Were you aware of that effort?
I wasn't, but that's the thing that's so inspiring about this is that we have people collecting petitions in every nook and cranny of this state. There's an 80-year-old woman who, in the coldest snap of the last winter, was going door to door to collect names on petitions. So, wherever you are, you can play a role. You can collect petitions. You can also, if you meet somebody who's living in the coverage gap, the number 615-900-GAP3. So you can call and share your story, 615-900-GAP3. I think it's an opportunity for us to show the country that in Tennessee we solve problems and we care about our neighbors. So I hope folks can join the fun.
Yeah, and as you heard, tomorrow at 12 noon at Corinthians there at Community Awareness Rally, Reverend Fuss, if you want to be behind it, it's part of several efforts along those lines. Thank you for your call, Reverend. Always good hearing from you. Let's see if we can squeeze in Paul real quick. Paul, good morning.
Hey, good morning, Nick.
Hi, Paul.
And good morning to your esteemed guest there. I'd like to say that to the good Reverend, I want to be the first one to sign that list. Nick, you know how my feelings is, and you made a statement earlier, Nick, about you not receiving that many callers on here, Nick. I'll just be honest with you. The vast majority of your callers are Republican. I'm the only solid Democrat that calls into your show, and you know that. And look, to Sam that called earlier that he's against it and cause it's going to take away research, Nick, you and I both know that's a bunch of horse crap. All it is they get their information from Rush Limbaugh, Glenn Beck, and Michael Del Giorno. Them cats don't care nothing about the poor people of Tennessee or nothing about people that need health care. We need to get health care for the good, hard-working people of Tennessee. And God bless you, Nick, for putting on this show, and God bless that young lady there for doing what she's doing. And I'm all for it, and thank you, and that's the end of my call. Thank you, Nick.
Hey, thank you, Paul. I appreciate it. Yeah, I don't always know the political affiliation of our viewers. I think a lot of them, both Republican and Democrat, they come through, but he's got a strong opinion on all this. For me, it comes down, it's not Republican or Democrat in my mind. I try to boil this down to the very most basic thing when I see this. Whenever I talk to you, you talk about the people calling and sharing their stories. When I imagine someone, and I don't care if it's in Tennessee or where it is, that has cancer in the greatest country in the world with some of the best medical care available that, you know, is here that can save lives, and they can't get access to it. And there are a lot of people either way that sometimes can't access. And then what makes it more shameful is that they could get access to it if this available amount of money was taken and accepted. That's to me is just, I'm wondering about the people suffering. That
right.
gets to me at the very base level. I just don't want people suffering, and I want to find ways to help them.
Right. And
it's that simple for me. It's just that darn simple. It's not politics, anything. Someone's suffering, I want them to get help. Period. End of story for me, and I'm willing to pay for it. Go ahead.
And I think that's what Governor Haslam. I think that's where it comes from Governor Haslam. Governor Haslam feels like it's our moral responsibility to take care of our neighbor, and we can afford to do it without adding one bit of taxes to our state. And why not do it?
And that's the shameful. There's people that can be helped, and then that I don't know. It's for me, it's not Republican or Democrat in my mind. That's just, on its surface, that's the way I look at it. I don't understand when we allow people to continue suffering. That's what bothers me. Tony, go ahead real quick, buddy.
Yeah, real quick, I got a question for you.
Yeah.
Just as gas prices rose and we had to pay for all that, and now we're in the healthcare ball game, and these companies are making a killing on jacking up prices, whether we have an Affordable Care Act or not. When are they going to get caught for what they're doing on jacking prices?
Well, you know, I don't know if he's talking about pharmaceuticals, if he's talking about insurance companies and keeping the rates. You heard the president call out the commissioner of the insurance commission here in Tennessee, and she responded about how you can make sure that, you know, it's not just a money grab. What do you think of that? Yeah,
I mean, the Affordable Care Act basically gives tools to every state to basically keep insurance companies from jacking the rates up. Basically, they have to justify their rate increases in a way that we didn't have before the Affordable Care Act. But the fact is, we're already paying for this care. So whether we take the money, the $1.7 billion or not, when people get hurt or sick and it's an emergency and they show up in the emergency room, we're paying for it. We're just paying for it in the most costly way possible. And so the question is, are we going to rationalize that payment? Are we going to take the dollars that we're spending and make it so that we can get to people before they're, you know, basically at death's door? And that's what I hope the governor's plan could do if we could make it a reality. So I'm worried as well that the healthcare companies could raise prices, but I think that the Affordable Care Act gives tools. If the state can set aside politics and actually focus on their citizens, that enables us to, you know, to control those growing costs.
Real quick, give out the number again for where people can call if they want to share their story. It's
615-900-GAP3, and we'll be there to take your call and get your story and make sure that you know, basically Tennesseans understand this is whose life's at stake.
Yeah, 600.
No, it's 900.
900 GAP3.
GAP3. Yeah.
Gotcha. Okay, that's the number. And then, you know, get involved. Contact your lawmaker. Hey, however you feel. And I know we had a caller earlier who's not necessarily in support. He may reach out and tell them that that's something that he wants them to continue to fight. On the other hand, if you feel otherwise, get involved. You heard Reverend Fuzz is organizing that event tomorrow at his church, and there'll be others like that. So we'll follow and see how it works out. And I know you will continue to come on and talk to me about it, Michelle, and try to get me educated.
Yeah.
Thank you. And what's the purple again?
This is for Insure Tennessee, because it's not blue for Democrats or red for Republicans. It's bipartisan.
That's the way it should be. People's health should be. Thanks for coming on. It's always nice having you on. I'll take a break. Be back with a programming note about tomorrow right after this. Stay with us.